Today I'm going to show you how to do a subcutaneous injection. That might be the Mike B12 injection for fat loss, but this would apply to any subcutaneous injection. I'm going to show you the supplies first, what to look for, and then I'll actually show you how to give an injection. So here we go. For the injection, what you're going to need is the actual injection. So this is the Mike B12 injection. You want to always double check the label and also the expiration date to make sure that it's not expired. And then we have an insulin syringe. This end of the syringe comes off. This is the plunger end. So this is what you would pull in and out when you're drawing up the medication and then injecting. This end, the needle is under here. You just pull the cap straight off. You can put it back on carefully, just make sure you don't blunt the needle. You'll notice the measurement markings on here. 100 is 1 ml. So this is an insulin syringe, and so 100 is representative of 100 units of insulin, but we're not giving insulin, we're giving Mike B12 today. So 100 units equals 1 milliliter. When I pull the plunger down, I want the top of the plunger to be just at that 100 mark. So it's not the bottom of the plunger that's at the 100 mark, okay? It's right there, I believe. Yeah, right there. Okay, so we want to make sure that we're doing this cleanly. I've just washed my hands and I've got alcohol wipes here. So what we're gonna do is first, the foil covering on the lid should be taken off, and be careful not to touch that gray part in there, because that needs to stay perfectly clean so that we don't introduce any germs to the needle. You want to take out your alcohol wipe and just for good measure, wipe the top. Don't blow on it, don't, wave at it like that. You'll introduce germs onto it. You'll see the bottle is not completely full. That's okay. There's usually a little bit more than 1 milliliter in there. Now you can hold on to the cap kind of like this. What you want to do is just put the needle straight in. Okay, I'm going to see if I can do this on video here. There we go. And then turn it upside down. And what I usually do is I hold the needle, the syringe steady with this hand while I hold this, and then I can pull back like this. Sometimes it's helpful to inject a little bit of air into the vial first because you get less resistance on pullback. And sometimes this is okay. And you'll notice that when you let go, the plunger kind of sucks back in just because of the negative air pressure built up in the vial. But it takes a little while because the needle is so thin, but we want a thin needle because it hurts less than when we inject ourselves. So just be patient. Be sure not to pull the plunger all the way out the back because you will lose all the medication and then you will have to start over. So we're almost there. If you have any air bubbles or anything, you can easily just give it a little tap, up here. But you're gonna wanna make sure that the tip of the needle is in the fluid. So that means that you might actually have to pull out a little bit at the end of when you're drawing up, or tilt the bottle a little bit like this, so that the tip of the needle still is in the fluid. Now they always have a little bit extra fluid in there because they assume you're not going to be able to get every last drop. Once again, you can recap the needle, just be careful not to poke yourself. If the needle touches anything, you got to start over, okay, because then it's not clean anymore. So what we're going to do, I'll show you on myself. What you want to do is inject right, there's your belly button, either here or here, and you're going to alternate spots, okay? So you want to clean first. Again, don't wave at it, don't do anything. So you want to go beside the belly button and just a little bit down. So you're going to take a little of your fat and squeeze it. Take the lid off, put it to the side, squeeze your fat a little bit, and then I have to count because I'm a scaredy cat, but you go 1, 2, 3, and then in. And you can let go of the fat there if you want to keep this hand here and use this one to kind of push in. Now the Mike B12 does sting a little bit. I'm gonna see if I can move my hands here so you guys can see. Okay, it does sting a little bit. That's normal. You can try injecting slow or fast, whatever your preference is. It really doesn't matter in terms of the effectiveness of the medication or the safety of the injection. Just make sure the needle stays in your fatty tissue the whole time. It may sting for about a half an hour afterwards. That's okay. Now we're done with the injection. It's all the way down, and you just pull straight out. And if there's a little tiny drop of blood or so, you can just give it another little wipe and then pull that down. So that's the injection process. What you want to do with the needle is you can recap it and put it in any kind of container that is kind of puncture proof. So either an old laundry detergent container, a mason jar is fine, an almond milk carton is fine, anything that you can put a lid on, and then you can actually just throw that container once it's full in the garbage. Some pharmacies will take used syringes as well. But any questions, let me know. Hopefully this was clear for you. This can go in the garbage. Everything else can go in the garbage. Anything that's sharp like this, remember, has to go in either a sharps container or a makeshift sharps container. All right, good luck.